A very good evening to Miss Shakira and my beloved friends. Today, I'm going to present one interesting topic about pregnancy, which focusing on importance of iron and folate. Based on recommended nutritional intake of nature, the 9 months of pregnancy represent the most intense period growth and development of a human ever experienced. How well these processes go depends on many factors, most of which are modifiable, and it is actually in our control. Okay, after I have introduced to all of you about this presentation, I will share the importance of iron, while Azika Baidura will share importance of folate and conclude this presentation. Ladies and gentlemen, for your information, iron status is a leading topic of discussion in a prenatal nutrition because the need for iron increases substantially. Approximately 12% of women enter pregnancy with iron deficiency and little stored iron. So before I'm going more detail, I will share some of iron functions that give a great effect to mother and baby. We need iron to produce a red blood cell, and for pregnant women, the body makes more blood to support the baby development. The immune system too is dependent on iron for its efficient functioning. Physical and mental growth also require sufficient iron levels. The amount of blood in our body increases during pregnancy until we have almost 50% more blood than usual. So, we need more iron to make more hemoglobin. We need extra iron for our growing baby and placenta, especially in the 2nd and the 3rd trimester. Members of the floor, I know all of you must be wondered on how to get enough iron, right? So now, I'm here to introduce to you which food is rich in iron so it can help you later when you become pregnant. Most of this iron has in seafood, internal organ, meat, fruits, vegetables, dried beans, nuts, and a grain product. Besides, we also can get from supplement, but we need to have advice from a doctor before we simply take it. So now, let's take a look at the if we lack of iron. Iron deficiency anemia is the major cause of insufficient iron, mostly in pregnant women. If in the beginning of pregnancy we lack of iron, it will increase the risk of preterm delivery and a low birth weight infant by 2 to 3 times. Iron deficiency during pregnancy is related to lower score on intelligence, language, gross motor, and attention tests in affected children at the age of 5 years. All of this related to decreased oxygen delivery to the placenta and fetus, increased rate of infection, or adverse effect of iron deficiency on brain development. The increased need for iron can be made by intakes that lead to an additional 3.7 mg absorbed iron per day on average throughout pregnancy. The amount of iron absorbed is determined by iron status in the body. The amount of iron absorbed will decrease if our body have high doses of iron. If we take a look at the symptom of iron toxicity, it is the nausea, cramp, gas, and constipation. It is occur because of the free iron in intestine. Because of that, you should be aware of recommended intake of iron because it will give deficiency or toxicity if we mistook it. So now I will call upon Azika Baidura to continue with this presentation. Thank you, zeatyischa. Now it is my turn to share to all of you about folate. Okay, for your information, the function of folate is required for cell division and also cell repairing. Okay, this kind of thing happen during 2nd and 3rd trimester of pregnancy. Okay, for your information, for the whole pregnancy, we have 3 trimesters. Okay, after knowing the vital function of folate, now let's look at the deficiency of folate. Okay, the deficiency of folate can result in neural tube defects. Okay, there are 2 types of neural tube defects. First is anencephaly and the second one is spina bifida. Okay, anencephaly effects, mothers need to consume more than 3 servings per day. Folate is available in a wide variety of foods, but in relatively low concentrations. However, it is particularly abundant in legumes, while green leafy vegetables are outstanding sources. Diets that contain an adequate amount of fresh green vegetables are good folate sources. Fortified grain products also contribute to folate intake. Okay, from the table you can see the examples of excellent folate sources, okay, spinach, asparagus and also lentil. While the good folate sources, kidney beans, cornflakes and also tomato juice. Okay, last but not least, fair to poor sources of folate. We can get from crackers, malt and also banana. Okay, before I conclude my presentation, let me summarize the key points of my presentation. Okay, let me recall back the key points. For iron, the function of iron is to help in producing red blood cell and also help in our immune body system. We can get the iron from the seafood and also meat that we consume every day. And if we lack of iron, the baby can get the anemia. Okay, while for folate, folate is helping in DNA activity such as cell division, and the sources of folate we can get it from the green leafy vegetable. While if we lack the folate, the babies can get the neural tube defects. Okay, for the conclusion, iron and folate is so important during pregnancy because it gives benefit to our health status, and we also can see the recommended nutritional intake among Malaysian focus on iron and folate status because it gives a big impact to our body system. Okay, that's all from my presentation. Thank you for lending me your ears.